Alright, get ready with me, guys, while I tell you guys my horror story of what happened to me when I got my boob job.
So in this video, these ladies are going to be talking about their horror story of what they went through after getting their plastic surgery. And these women went through a lot after having it done. I can only imagine how they were feeling and what they went through. This video is for entertainment purposes only and allegedly.
So let's go ahead and get right into it. I got my boob job back in about 2023, and I had been looking around and I had found this place called Me Aesthetics, and I decided that I wanted to stay local because I do have 3 kids and it just wouldn't have been conducive for me to travel with 3 kids or be gone, you know, just in case. And I also wanted to keep in mind that I wanted, if something was to happen, I wanted to be local. And I feel like this really came in handy once I finally tell the full story of why I think you should stay close by enough to go back to the place of your surgery. The horror part wasn't the surgery itself. The horror part came after the surgery. So when I wake up, I am in excruciating pain, guys. Like, I will give the pain, and this is coming from somebody who has a really high pain tolerance. When they say you get out of surgery and it feels like a ton of bricks hit you, it's no joke. It was excruciating, quite frankly, and it was just like, oh my God. And this is coming from somebody who has a really high pain tolerance. So I give the pain an 8 out of a 10.
You know, she was in a lot of pain to give it an 8 out of 10. And like she said, she has a high pain tolerance. And most people that have a high pain tolerance, they can be in pain and you don't even know they are in pain because they can mask it and handle it pretty well. As a person like me that does not like to be in pain, you can see it on my face. Like, I can feel the pain. I'm not going to be talking. I'm not going to be doing none of that. But for her to give it an 8 out of 10, she was in a lot of pain.
And this is the part where it starts to be like, okay, what the right after my surgery, I guess I had been in recovery for about 2 hours. They literally pack you up and send you on your merry way. So you get in your car, and I realized when I was in the waiting room, other things, like, they're doing multiple surgeries. So this is a bit of a chop house.
To describe the surgery place as a chop house is insane. Like, that would have been a red flag for me too. When I come in and I describe it as a chop house, and it's like other surgeries going on. Well, I know some places do it. Even doctor offices, they do different surgeries. But like I said, to describe this place as a chop house is not good at all.
So they send you in the car, and I just remember, I'm like, I literally am just like, what the fuck? They just send you on your merry way. It's still just uncomfortable to move around and everything like that. So let's fast forward now for about 2 weeks when I go back to work and everything like that. So after about these 2 weeks, you do go to appointments. Again, this was a minute ago, so I can't tell you how many appointments I went to, but by this point, I don't think I had to be seen every 3 days. I was cleared enough to go back to work and all that. And I did notice you do have stitches that don't fully dissolve until about 6 months. And I did notice my stitches were a little funky, so I was like, okay.
Oh man, anytime your incision starts to have a smell to you, I already know where it's going. That means there's an infection and something's not right with those incisions.
I remember calling in because there was a little bit of liquid coming out of the stitches. So this is the part where so there's not a direct number for the doctor, and I didn't have that. I only had the number that basically was the number for the hotline. So I called the hotline and I basically tell them, like, hey, I feel like there's a little bit of pus. And she's like, oh, it's normal. Like, it's probably just fluid leaking out, which, looking back, I probably should have just got a second opinion, but I think nothing of it.
I noticed in every video I have watched of women talking about their horror stories dealing with plastic surgery, it's the same when they call the surgeon or call the nurse or anything, etc. It's like they're like, oh, well, you'll be okay. That's normal. Just look over it or just take some pain pills. It feels like, to me, like I said before in one other video I did, it's like once they get that money from you, they do not give a ish about you. It's like once they get that money, they do that surgery for you. It's like next, and they throw you out the door and bring the next person in. They don't care what happened to you after those surgeries.
And this is when I'm sitting at work and I just noticed, like, the liquidness is not getting better. So this is probably about week 3 at this point. So I'm just like not thinking much of it. I continue to work, and this is when I was working at a call center, and I just remember sitting at my desk, and out of nowhere I was like, oh, I feel a little sick. But then it hit me like a ton of bricks. My coworker next to me was like, you look really pale. Like, are you okay? And I'm like, no, I think I'm going to go and tell my boss, hey, I think I need to go home. I'm not feeling too well. I drive home and then I immediately go to the urgent care and I like tell them, hey, I just got surgery. And the lady, this is back when Jackie Ann died and everybody believed that she had died from the plastic surgery. So the lady was very alarmed. So I go to the hospital, and while I'm doing this, I am still on the hotline, and they're basically telling me like, oh, they don't have any available appointments. And I'm just kind of getting frustrated because I'm telling them like, hey, like, I feel like I have the flu. Like, I feel like I should just be able to come in. And they're like, oh, well, the office for outpatient doesn't have any appointment.
And it's the fact that she's having to call a hotline to try to get help from after getting her plastic surgery done. She doesn't have the direct number to the doctor. She doesn't have the direct number to the nurse. It is a hotline that she is having to call. And then they're telling her they do not have appointments available. And this woman is saying that her boob is literally leaking fluids.
So I'm getting quite irritated by this, because obviously I'm having complications. So the only option that I had was to go to the hospital. And when I go to the hospital and I explain to them what happened, they tell me basically at this point, once I keep calling, that they have something for the next following like day or two. So I'm like, okay, well, I guess I'll just have to wait. I go to the hospital and they're shocked also by the fact that they're telling me that I have to come in like 2 days. Like,
I agree with the hospital. It's the fact that they want her to wait 2 days. Do you know what can happen to a person within 2 days that have an infection and they don't get any treatment? Some people can end up losing their lives because that infection can go all over their body, like rapidly. The fact they want her to wait 2 days pretty much show you that they didn't give a ish about this girl.
I just didn't understand that. But again, I have to understand that this is a chop house and that it is not like, you know, one of those places where it's just kind of like a money thing where it's like, okay, you're just a patient with a number. Because even when I used to go into the patient, like the outpatient, it was just filled with lots of people who had surgery. So it was definitely just not my favorite part about that.
Yes, I just said that it's all about the money. And like I keep saying, once they get that money and do the surgery that you want done on you, they are through with you.
Come to find out, my stitches did end up getting an infection and I ended up getting medicine and I felt a lot better. And then from that point forward, everything was fine. But then even after that, once I felt better and they had called me, they never called me again. And I never heard from that place again. And I just personally feel like I wouldn't recommend a chop house. I think chop houses are a horror story, and if I was to get any more surgery, I would not go to a chop house. I would pay the money and go somewhere else.
Thinking about having a tummy tuck? Well, please listen to my short story before you make that decision. So 2.5 years ago, I had the tummy tuck, the 360-degree lipo. That's where they take fat from your love handles and your back. And then I had the fat transfer to my breast. Worst decision I could have ever made in my life. Number one reason being that I almost died. Oh yeah, I almost died 6 hours after surgery. My body went into shock.
See, hearing things like this about she almost died from a plastic surgery makes me scared of even wanting a plastic surgery. Or even, I don't even like getting a regular surgery. And I know surgery is surgery when it's something like dealing with medical issues or things like that. I don't even like going to get surgeries for that because I always have that what if I pass away while they are doing surgery or after surgery. So I commend you women that do go get this type of things done and know that, you know, it could be a possibility that something serious can happen to you. I'm too scared to do it.
So for the nurses out there, my hemoglobin went down from 12.1 to 5.0. I had to receive 3 units of blood and I was in the hospital for 3 days. Worst experience ever, traumatizing. I can still remember hearing the nurses saying, Shauna, stay with me. All I wanted to do was go to sleep. I wanted to enter a deep sleep. And every time I would close my eyes, it would be freezing cold and I would see utter darkness, just complete blackness. I couldn't sleep for months after the surgery.
Oh, I can imagine, because if I went through that, I wouldn't be able to sleep as well. I would be drinking energy drinks all day, every day, just try to stay up, because I would be so scared if I go to sleep that I would have that type of feeling again and that would happen to me again. And this time I would not wake up.
It was traumatizing. It was just terrible. And so for that one reason alone, I would not have had it. I didn't know my body would react like that. You don't know how your body's going to react to the surgery. So you have to keep those things in mind, okay? And as far as the fat transfer, ladies, please do not do that. I don't recommend the fat transfer to the breast. Complete waste of time. It costs more than the implants. Had I known my body was going to reabsorb everything, I would have just gotten implants and been done with it.
Wow, so she spent more money on doing the fat transfer, and it did not pretty much turn out the way that she wanted it in the end. And like she said, she could have just got the implants and been done with it, and she spent all that money to get a surgery, and the results was not what she ended up wanting. That's crazy.
So do not get the fat transfer, please. Anyway, I am happy with the tummy tuck results, or as far as that goes. Your fat does start to come back in your belly, so this is not a cure-all, ladies, okay? So keep that in mind.
So you telling me I can go through all that to get a fat transfer and could lose my life for the fat to come back into my stomach after a while? Yeah, that's a waste of money.
But again, if you're willing to go through with it, just know the huge risk involved.
This is a warning for any young woman considering getting plastic surgery. I almost lost both my breasts to a severe infection because I could not stop changing my outward appearance. Plastic surgery is a form of self-harm, and I don't really think we talk about it enough. It was early January 2023. I had scheduled an entire breast reconstruction. In 2020, I got my first boob job. I had 300cc implants, which weren't very big, but they looked pretty big on me at the time. Due to everything I experienced, I spiraled into a very deep depression and ended up gaining 40 pounds. Gaining 40 pounds when you have a boob job does not mix. That is another thing plastic surgeons don't tell you.
Well, I just learned something new because I didn't know that you shouldn't gain weight while having a boob job done on you. I thought once the boobs are there, if you gain weight, you gain weight. But I guess pretty much because it makes the boobs heavier, and it does not, I guess, look appealing like it was when you first got it done, when you were at the weight that you were at. I'm guessing I don't too much know.
My boobs went from a full C cup to a double D cup, and they were starting to hang low. The extra weight plus the implants was just a really horrible combination.
Well, she just answered the question for me because that makes sense, because now you have fat mixed with those implants that's in your breasts, and it's making them push out and making it bigger from the fat from you gaining weight as well. So she just answered the question for me.
And my first surgeon didn't really do my surgery right. He had put my implants above the muscle. It was just not good. The real solution to my problem would have been losing weight and going to therapy. I walked into a New York City plastic surgeon's office. I handed him $20,000 and said, "Fix my boobs." If he was a good surgeon, he would have told me, "Hey Ava, maybe you should lose some weight first."
That is true, because the surgeon that really cares about you is going to be worried about your health even before having surgery. I know of people who have had surgery, not plastic surgery, just medical surgery, and they have told me that their doctors have told them they will not do surgery unless they lose a certain amount of weight, because it makes it easier, on the patient and the doctor as well. So that is true. If you have the right surgeon that care, they will tell you that before doing surgery.
But no, of course, plastic surgeons want money. I woke up from my surgery and I was told that I had a lot of scar tissue in my boobs and that it was very rough. They didn't really give me post-op instructions. Before my surgery, they told me to quit vaping for 2 weeks. Only 2 weeks before my surgery, they told me to quit vaping. I complied and I stopped vaping, but they didn't tell me, "Hey Ava, come get checkups after this. Be on top of it. You did vape. This is not going to be good for your boobs." When it came time for me to finally get up and take a shower, I noticed a big part of my incision had turned black.
Oh no, ma'am. I would have fainted the moment that I seen my breast was completely black in that area. I think I would have been passed out in the restroom, and my husband would have had to come in there and drag me out of there, because that would have shocked me, and I would have been so scared seeing my incision just black. That means pretty much her skin was dead.
My skin was pitch black. I've watched Botched, okay? I know what necrosis is. My skin had died. I emailed my plastic surgeon saying, "Hey, I think I have necrosis. How serious is this? I'm worried." They told me not to worry about it, and that is so messed up. I'm sorry.
See, it's the same scenario over and over again. Like I just stated earlier in this video, that all these women have in common. Once they get those surgeries and call those doctors when something is wrong, they always tell them, do not worry about it. They are done with you guys. Like, I don't know why people keep running to these surgeons to get these plastic surgeries, and when something happens to you and you call them, they do not care. It's the same cycle over and over again when I watch every single last one of these type of stories.
Like, if any of your patients get necrosis, the first thing you should say is come into the office now. A couple days later, I noticed the tissue went from being black to turning gray, and it looked like a scab. I thought everything was fine and that it was just a scab like near my incision and that I was gonna be okay. And then I got a fever. My fever was sky high. I was shaking, my boobs hurt so bad. I knew I had an infection, I just didn't know where. I called my plastic surgeon's office, barely able to speak, saying, do I need to go to the hospital? What's wrong? I don't know what to do. And my plastic surgeon told me, Ava, just get some antibiotics. You're gonna be fine. I took them. It did help. My fever went down. But then things got messy. My left boob exploded. The antibiotics were pushing the infection out, I guess, so my incision just split and pus was dripping down my body.
No way. I would have panicked to be just minding my business. You know you're in pain and your breast explode from pulse getting pushed out of it by the antibiotics, and I'm seeing it run down my body. I would have went into complete panic mode at that moment.
I arrived to the hospital and they were horrified. They told me that the surgeon should have never performed the surgery on me knowing that I vaped. When you vape, and when you vape as much as I vape, your blood circulation is horrible. The blood could not make it to my breasts and to my incisions to heal my skin, so my skin ended up dying. The people at the hospital were talking, being like, this is why we hate plastic surgeons sometimes, like, you were definitely not a candidate for the surgery, we're so sorry, but hey, you might end up losing your boob. I was crying, I was stressed, I was upset. Luckily, they were able to fill me with antibiotics, they did an ultrasound, the abscess wasn't that deep, and they sent me home. When I got home, the wound was maybe this size. Over the course of 3 days, as the infection drained out, the wound went from being this size to the size of my palm. My breast looked like a filet mignon. I called my plastic surgeon. I said, what can we do? Can you stitch this back up for me? And they told me, no, Ava, you're just gonna have to let it heal. Like, we can't stitch that together for you. And then it happened to the other one. My other boob got infected and I had pus leaking out of it. You know, the skin was sloshing off. I didn't end up going to the hospital this time because I said, there's nothing they can do for me anyway.
The fact that her other breast did the same thing to her is crazy as heck. It is insane. I guarantee you she was in a lot of pain with the breast that she was dealing with at first that had that issue. And then your other one does the same thing to you. I know this woman was miserable.
For a good 6 months of my life, I was literally nursing giant palm-sized wounds on the bottom of both my breasts. It was horrible. Yes, it was my fault because I vaped, but also the plastic surgeons do profit off of other people's mental pain and bad decisions, and they let me get it done.
You all, what do you think about these stories? Like, have you heard stories like this before? For me, just watching different stories like this, have seen numerous stories like this now. And from watching all of them, like I stated earlier, they all end up with the same scenario. The surgeon doctor does not help them in the end, and they either have to go to the emergency room or have to try to figure out a way on their own to try to take care of it, or go to a whole nother different surgeon. So what do you guys think about this video? Do you feel like they should leave these plastic surgeries alone, or if it's like, hey, it's their body, their choice, let them do them? Let me know down in the comment section.